Does your phlebotomy tray or outpatient area look this sloppy? If so, the patient is entitled to think your technique is sloppy too, and so is that of the laboratory. Take a look at your outpatient area and your phlebotomy trays through the eyes of a patient. What do you see? Are they neat and tidy? Well, then it looks like you're organized and that you have high standards. In no setting is it more important to project a positive image than it is in healthcare. But I would caution you, don't be so obsessed with looking organized that you pre-assemble your blood collection devices in advance of the patient arriving to your station, or in advance of you arriving to the patient's bedside. Patients want to have that confidence of seeing you assemble those devices in their presence. Look, you're only going to save a couple seconds, so instead, let that patient see you assemble those devices from the sterile environments of their packaging. Let them see that you've assembled it fresh. As long as you're pre-assembling your devices before you get to the patient's side, there's always going to be that potential for the patient to be fearful of the care they received. So make sure you give that patient the confidence that they need and assemble your devices in their presence, and eradicate the potential for them to go away thinking that they might have just been drawn by a leftover needle from the last patient. What image does this present to the patient? What does it say to the patient when they see something like this? In your outpatient draw stations, if it creates a negative impression, eliminate it. What kind of impression does this present to the patient who walks in for lab work? It's not very flattering, is it? Take a look at your outpatient areas through the eyes of a patient and eliminate those things that you wouldn't like to see if you were the patient.